Faux Rook. This is going to be one of the most comprehensive and in-depth videos you can probably see on the internet about that particular piercing. I'm going to cover pros and cons, of course, because that's what we do here. I'm also going to cover preparing and what you should know beforehand, getting the piercing, healing, what it's like living with the piercing, and then what happens if you decide you want to take it out. Coming up next on Pros and Cons by a Piercer, Season 2, Episode number 78. For those who are new to the channel, welcome to the Body Piercing and Tattooing channel. Hope you're finding the videos helpful and useful, because that's why we do them. But you may not know who I am. Maybe we've never met. My name is DaVo. I'm a professional body piercer and have been since 1994. I own and I operate the Axiom Body Piercing Studio, located right here in Des Moines, Iowa, inside Skin Kitchen Tattoo. Now, what is this piercing? Well, it's a piercing at the top of the ear. Everybody has kind of this natural fold or ridge that goes along the top. It is done towards the front, right on the top. Done straight through, usually with post-style jewelry. And the reason why it's called a faux rook is because it kind of gives off the appearance that you have a rook piercing without it being a rook piercing. Rook piercings are done almost at a downward angle or upward angle, I guess, almost vertical, and they're done with a curved barbell. They're not done all the way through the back of your ear. They're just done through that ridge of cartilage. This piercing was designed for those that had issues with anatomy and getting this piercing done, because it does give you that look without having all the issues that would be attributed to you not having the right anatomy and getting a piercing that isn't going to work. As far as the history of this piercing, there's not really much. It's a pretty modern piercing. I'd say developed in the last 5 to 10 years, if that long ago. I'm sure people were doing it before that. I know I've done piercings in this style in that location in the past, probably all the way dating back to the 90s. But as far as it having a name and people actually getting it done or people offering it, it's a new thing. The pros, the advantages, the things that make you go, yes, this is for me. Start with number one. This piercing can be done in situations where the person does not have the proper anatomy for a rook piercing. With rook piercings, we're trying to look for something that's peaked right there. And the reason why we want it more peaked is because we're going through one side and out the other side. We also want it to be large enough that it's going to be completely anchored into that tissue. With some people where the ear is more flat and that fold isn't as pronounced, it just doesn't work very well. From the same standpoint, if you have a really strong ridge like mine, where there's almost like a notch area in there, you're not going to be probably the best candidate for a faux rook because there's just not room in the back because that fold is almost complete. Number two, widely socially acceptable. This is not a piercing that's going to get you dirty looks out where you're gathering with your friends and family. It is not one that's probably going to affect employment. There are some situations where it can, especially in organized sports, employment, or organizations where there's a very strict dress code. I'll go a little bit more into that later on, but just so you know that in advance, most people are not going to have an issue with you having this piercing, and they're probably not even going to notice you have it. And if they do, they're going to be like, wow, that's cool. Number three, there's a wide selection of jewelry out there for this particular piercing. Because this is done usually with threadless jewelry, there are thousands upon thousands of different style ends, gems, colors, and then when you anodize stuff or have different materials like 14 karat gold, a whole load of new options. There's a lot of things you can put in this. Has a good history with healing. Not usually as traumatic in often cases as the rooks are. Less risk of rejection or migration. It does have its own, and we'll cover some of that a little bit later. But for the most part, this is a piercing that heals about the same as a helix. It's a long heal, but it's going to heal eventually if you do the right things. Take care of your piercings. Number five, slightly less uncomfortable to get done than a rook. Now, the reason why I say that is with rook piercings, there's usually kind of a little bit of, no matter how much you bend or use hook needles or whatever, there's a little bit of pressure that's back and forth on that area. either during the piercing procedure or slightly after. And that can add a little layer of discomfort to getting this piercing done, mostly revolving around getting the jewelry inserted. It continues to surprise me that in an industry where guide pins, both threaded and threadless, are widely accepted as the norm, nobody has come up with a curved one or a hooked one yet. I don't know why, but hopefully one day they will. Now let's move on to the cons and disadvantages, the things that make you say, no, I'm not going to deal with that. I do not need that in my life. Number one, this can be a piercing that can be a little difficult to isolate. And isolation is very important, especially when it comes to piercings that are through thicker cartilage, like helix piercings and etc. It's just one of those locations where it can be a pain to keep things away from it. And what I'm talking about is things like hats, helmets, glasses, over-the-ear headphones, helmets, headbands, and you can't sleep on it, which is I'll talk more about later. Number two, may have contact with your glasses because you're going to have a flat disc in the back there, and it's going to be a bit long during that initial 6-week period. There's a real risk with people that wear glasses or sunglasses of constantly having contact with the piercing, possibly causing infection by cross-contamination or just hooking the jewelry and causing problems. It's very important, and I'll probably mention this again too, that when you do come in, if you wear glasses on a regular basis, like reading glasses or what have you, or sunglasses, bring them in when you get pierced and make sure that piercing is going to be away from it. Number four, I always put this on its own because it's important to know. You cannot sleep on this piercing, especially during the healing process and the seasoning process, which means 2 to 3 years. Even after that, thicker cartilage piercings like helixes, rooks, conches, etc. They don't like that sleeping even after they're well healed. Often they'll be sore and tender the next day. So it's one of those things where you kind of are going to have to change your sleeping patterns, and you should know that in advance. Now let's move on to preparing and what you should know beforehand. If you're employed or involved in organized sports or activities or anything that has a dress code, you need to consult with those in charge to see if this is going to go against that. More conservative dress codes usually will only allow 2 lobe piercings, and that depends often on what they decide is your gender. So understand that it may be an issue, and do your research beforehand. Nothing sucks more than getting a piercing that you're really excited about and looks really great, and then you go to practice or work or whatever the next day, and you have to take it out because they won't let you participate unless you have the jewelry out. The next one in preparing is research your piercer. Make sure that they're knowledgeable, they have expertise in this piercing, in experience. Make sure that they also will do a consultation with you that will involve the risk of this piercing, what it's going to take to heal it, help you with jewelry selection, also understand your anatomy and be able to read it and know that it's correct in a very quick moment. Basically, and advise you if you don't have the perfect anatomy that maybe this isn't best or this is a problem or that's a problem. It all comes down to experience, and I know people will go, it's just an ear piercing. Nothing has the level of variety as far as anatomy than this area of the ear. That upper ear area is vastly different from person to person. You really need to know what to look for that's going to work and what to look for that isn't going to work. And that comes from experience and proper training. Next is the jewelry that's being used by your piercer is high quality and biocompatible certified, meaning it's been certified by a third party. This piercing demands isolation. It's an isolationist. And it will be a mad little burger if you don't do that. So prepare ahead of time. If you plan on trying to sleep on that side, invest in one of those U-shaped travel pillows and a bunch of tube socks. You just put a new tube sock on it every night, and you sleep with your ear in the center of that. And get used to sleeping with it beforehand. So it's not as much of a change as it would be if you just suddenly did that. Otherwise, train yourself to sleep on the other side or flat on your back. Other things that you want to prepare for is making sure that either your piercer supplies or sells sterile saline. Also, or if they don't, find it beforehand. And make sure that there's no activities coming up in your life that may be affected by this piercing or avoiding cross-contamination. I'll get into all those things a little bit later. Big thing would be, like I already mentioned, you want to ask whether or not they supply the aftercare product. And in this day and age, as of July of 2024, that means sterile saline spray. That doesn't mean anything else. Most places will sell it anywhere from $10 to $20. I've heard much more, like $25 at one place, which is a huge markup. Basically, otherwise you need to know they should be able to point you in the right direction. Otherwise, they should be able to point you in the right direction on where you can buy it. The other thing is, do they sit down with you and give you a basic overview of taking care of the piercing? With me, I usually, during the consultation, the verbal consultation, I'll cover most of the cross-contamination prevention. And then when we talk about afterwards, I talk about how to properly clean it. I explain that. And then I'll go into when the jewelry should be downsized, whether or not, how long you will leave the jewelry in, some basic information about jewelry information, and then what normal signs are, and all that information. The reason why I go through all that at the end is to give you the opportunity, if there's something that you're not clear on, to ask that question. Because otherwise, if people just hand you a piece of paper and don't really talk to you, or give you a QR code and say, yeah, pay on the way out, they're not really giving you an opportunity to go, I don't quite understand how this stuff works. And it's important that you know that. This piercing may take a year or more, well, probably not more, but up to a year to heal. You need to be prepared for that in advance. This is not all these things we're going to ask you to do or tell you that you need to do. You're going to have to make that commitment to do that for probably around a year. And you need to understand that going in. The next thing is the jewelry will need to be downsized. We always pierce with jewelry on this one, at least I do, and most reputable piercers do. They'll pierce big. And the reason why we do that is to allow for inflammation. We do not want to create that perfect storm of the jewelry's too short because the piercing's swelling. And the piercing's swelling because the jewelry's too short, and the jewelry's too short because it's swelling. This vicious circle that can only be solved by putting another piece of jewelry in. We want to have that extra room for your body to do that. Also, when it's going through its heaviest production of discharge, that it can be a little easier to remove and doesn't kind of gather around the jewelry ends and back. So understand you're probably going to be asked to come back and downsize a shorter piece of jewelry in about 6 to 8 weeks. The reason why is because you don't need that longer run in there. It's just going to increase movement, contact, and etc. But also, these are prone to kind of migrate off of the angle and even move a little bit if they have that longer barbell or longer post in there, just basically because of pressure and contact and etc. So it's a good idea to make sure that you're going to come back in 6 weeks, have that thing downsized, and always have a professional do it or use a guide pin to change the jewelry. Now, another thing to consider is this piercing may affect your ability to wear helmets, over-the-ear headphones, and hearing aids. If you do any of those three things or use any of those three things on a daily basis or a regular basis, you really need to figure out how much contact that piercing area is going to have with those items, especially if they're constrictive like helmets are. And with helmets, it's constrictive while it's on, but it's the pulling off and on that usually causes the damage. Now let's move on to the piercing experience itself. A lot of people, most of my clients have said this is between a 2 and a 6. Mainly right there in the middle is probably the most common, 3 to 4. It's about equivalent to getting any type of flat piercing or upper ear helix piercing. It's about the same amount of moving around and etc. So it's about on that level. Usually these are kind of an ow and then a lot of heat and throbbing and aching that usually fades, and then it's just tender as a touch. As the process works, first off, we have a consultation where I verbally go through the risks check your anatomy, pick out jewelry, tell you how to take care of it, cross-contamination prevention, all that fun stuff you should know so you can make an educated decision. Next, you fill out a waiver, and then I start setting up a bunch of stuff. Once I'm set up, we'll disinfect the area, usually with a surgical scrub, and then mark the piercing. When marking, it's always a good idea if you have future plans in that general area for additional piercings, talk to your piercer at this point in time so that they can kind of map it out and make sure there's room for those other projects that you have in mind or the rest of the project. Now, with marking, we're going to hold up a mirror, and you might be able to see it, you might not. What I generally suggest is if you can't get a clear view of it, because we can't see the side of her head. See, I can't see it. If you have a friend with you, have them take a photo with their phone. Otherwise, use your phone, take a photo so you get a clear view of where it's marked at and make sure that's where you want it. At this point, I will tell the person to recline or lay down. Turn their head, inject the needle in and through. I might have them do a breathing exercise if I feel like they're really stressed or I'm just in the mood for heavy breathing. Once the needle's through, we're going to push it out with a guide pin. Threadless is my most common piece of jewelry I use on this one. So we hook that in the back, push it back through with that disc against the back, put the front on, stop any bleeding that may occur, and usually these don't bleed a lot. I guess I did just kind of skip candling. It's not a bad idea to have the area candled. And candling is where you put a flashlight or pen light behind the area to kind of map out where those veins are or blood vessels so that we avoid them. Then what I'll usually ask is, are you lightheaded or anything I need to be concerned about? And if they're okay, I'll go, well, go take a look. Immediately after, like I said, you're going to have some heat, usually, some throbbing and aching that usually lasts a few minutes. If that, then it's going to be tender to the touch. It's going to constantly remind you to not mess with it. Of course, I've already talked about this, but jewelry will be loose fitting. It may look a little odd at first as far as aesthetics because it has that longer post in there. Remember, this is temporary. You're going to go to a shorter barbell or shorter post, labret post in most cases, within 6 to 8 weeks, and that'll kind of end that issue. Now let's talk about healing. Average healing time on this, like I said, it's a big spectrum of different lengths. I would say between a minimum of 3 months if you're super healthy and heal quickly and have a high tolerance for piercings to a year or more. You know, everybody's a little bit different. A lot of it depends on how you're living your life, your lifestyle, how well you take care of it, and how well you isolate it, and how healthy you are. Main parts of the healing is twice daily cleaning with a sterile saline solution. Personally, I like Neomed's Piercing Aftercare. It's what we stock and sell here at the studio. Comes out in a fine mist. It's really easy to use. You just mist both sides, let it stay in contact for about 5 minutes. If there's any excess, you're welcome to pat it dry, but otherwise leave it alone. If you can't find that or it's not available in your part of the planet, or you just, for one reason, I used to have this joke all the time from friends. It's like, yeah, I went out to get that, and it's available everywhere but Des Moines. If you have that situation, there are a lot of things in the market that are comparable. The main things you want to look for is it's in a metal can. It says sterile on it, and it's pressurized. And when you turn it over on the back and look on the back, it says the only ingredients it has listed there are water and sodium chloride. Nothing else. If it has anything else in it, that's not what you want. Biggest difference in a lot of these products is how that saline is delivered. If it's the kind that comes out in a fine mist, like I said, just mist it. If it's the kind that comes out like a super sucker, like a really powerful stream that you can put fires out with, that might be a little too much pressure to put against there. What I would generally suggest doing is kind of a cold compress, take a sterile gauze sponge, saturate it, and then put it against it. I've also had clients go and buy different products from that particular manufacturer, like their nostril spray, and their nostril spray had a different nozzle on it that worked. So they are interchangeable in most brands, just kind of a little bit of pro tip there. The other thing I suggest doing is at the end of your shower, pull your hair and everything out of the way, and let the water flow over the area. What we're trying to do with these two things, the saline and the rinsing in the shower, is remove that hardened, crusty discharge that hardens the crust on the jewelry, the crusties. And the reason when it author is when it shifts and moves, it'll agitate the piercing, which can lead to issues. It's not very comfortable. It can feel like a scab's being pulled off every time you do it. And also, you need to make additional room for additional discharge. If you feel like it's not coming off or there's an excessive amount of it, see your piercer, have them take a look at it and clean it for you. Do not run to the medicine cabinet and start pulling out everything tipped in cotton or with a sharp point or was suggested by somebody on the internet and start digging around in there with like a toothpick. You're going to cause problems. Also, it's a good idea if there's a lot of it and it's just not coming off, there might be something else going on that your piercer needs to address and try to correct. Now, swelling can last anywhere from 3 to 5 days, sometimes longer. You can reduce the amount of swelling you see by avoiding contact, isolating the piercing, like I've been saying over and over again. Also, the first week or so, if you can sleep your head elevated above your heart, that will help with the swelling because there won't be as much blood supply to the area that we get when we're laying flat. Ice packs, possibly. The only way I suggest doing it is crushed ice in a sealed Ziploc bag, wrapped with a clean paper towel, and lightly laying against the area. If you notice discomfort when you do that, I wouldn't suggest doing it. The other thing is, if you've never had any issues of over-the-counter anti-inflammatories, they may be okay. I'm not a physician. If you, whenever in doubt, consult your medical professional. Now, it's very important to isolate the piercing and avoid contact with unclean objects. Cross-contamination prevention is part of that. Wash your hands before you handle it. No oral contact. No exchange of bodily fluids. Keep your environment clean. Think about what comes in contact with the area. Clothing, bedding, towels, wet hair, anything. All that stuff needs to either be avoided or disinfected and cleaned on a regular basis. No swimming. Sorry. I know a lot of places, a lot of people will tell you, yeah, you can go swimming. You know, why else would I have a piercing shop 20 feet from the beach? The reality is you cannot get in a large body of water that's big enough for you to move around it and submerge your whole body without there being microorganisms in there. Yes, the risk would reduce over time, but the reality is there is always a possibility of one of those microorganisms working their way into the piercing and causing an issue known as an infection. There's also the issue of having issues with moisture problems and chemicals that they use to treat pools. Just stay out of the water until it heals. Avoid contact with wet hair. Helmets, hats, sunglasses, glasses, over-the-ear headphones, and phones. If you have to have contact with these things, disinfect them on a regular basis. If you feel any pain or discomfort when using them, use the other ear or don't use them at all. Avoid playing with the piercing. Touching it over and over again to make sure it still hurts is not going to help the piercing. It's your body saying, stop touching it. Also, there is absolutely no reason to spin, rotate, or move the jewelry. There's no benefit to it, and it will actually prolong healing and lead to other problems like infection. First 3 to 5 days, you might notice a little bit of redness, discolorization, heat, tenderness of touch, inflammation, swelling, slight bleeding. Most people with the bleeding, these don't bleed a lot usually, and it's not a continuous thing. If you're starting to see a lot of bleeding, especially first thing in the morning, you're sleeping on it. You may not know it, but you're rolling over in your sleep and you're causing it to shift and move and agitating it to the point that it bleeds. So it's something you need to correct right away. Let's talk about jewelry. With this piercing, I suggest flatback labret or labret, depending on how you want to pronounce it. I don't want to get into it. It's unimportant. You know what I'm talking about. It should be made of a biocompatible material, preferably titanium, unless you're specifically allergic to titanium. I like threadless for these. Just basically because of the universal use from manufacturer to manufacturer, and also they're easy to work with and pretty much good quality. You can do this with threaded labret, but you want to make sure that whatever your piercer's selling you, it is internally threaded, not externally threaded. Difference between the two. Internally threaded, the ball is like a screw. It screws into the post. Externally threaded, the ball is like a nut, and it screws onto the post. The post is the screw. The problem with this is that rough threading and the fact that this is old technology. All high-end jewelry manufacturers have switched out to internally threaded years ago. This is either old stock or it's really cheap garbage. You want to downsize in roughly about 6 to 8 weeks, as I mentioned earlier. Also, if it is threaded, it's a good idea to check the tightness of the balls on a regular basis throughout, even after the piercing is healed. They tend to kind of unscrew on their own and fall out. Flatback or the threadless, you just got to make sure they're in there all the way, and you don't really have to do much else. They rarely come out unless they really get caught on something. I don't know if I covered this in cross-contact. I said no wet hair, but I didn't really get into this. Make sure that your hair is completely dry before it comes to contact with the piercing. This can cause a couple different problems. First one being is infection caused by transfer of fungi and microorganisms in your wet hair, but also it can cause issues with moisture. One final thing on jewelry. Back to jewelry. I'm usually pretty good about this, but every once in a while I'll forget something and then I'll remember it, and it's, yeah. I have notes, but do I look at them? Anyway, jewelry. Last thing. If you have a situation where, for medical reasons, that you have to remove all metal objects from your body, regardless of how much you can prove that they're implant grade and the same material they're going to be using, glass is your best option. It can be worn in the piercing for a short period of time. It doesn't really show up on x-rays as readily or scans, and it won't be attracted by magnets, and it's non-conductive. And I would see your piercer to have them help you put it in. Now let's move on to living with the piercing. If you have threaded jewelry, check the ends weekly. It's just one of those things that you want to get in the habit of, just like once a week, you just make sure everything that's threaded is tight on your body. It's when you don't pay attention for a while that they'll start loosening up and then falling off. And nothing is worse than that, because they can be a pain to start again, especially in areas like the ear and that area where you can't see what you're doing. If you suddenly, like let's say the piercing's healed, it's seasoned, if you suddenly start to discover pain and swelling and all kinds of other problems, consult your piercer. I think a lot of people have this misconception that after it's healed, you can do whatever you want with it. The reality is that it's still hard metal through soft tissue. It is possible that trauma could lead to damaging the piercing, which could lead to other issues. So it's always a good idea, if you start seeing any type of signs of problems, to get a hold of your piercer. The other thing is to kind of continue and get in the habit of just isolating the piercings and treating and babying that area, just to make sure something doesn't happen to it. You have a piercing you love, take care of it. Now let's talk about abandoning the piercing. Here's a couple cases. First one being, it's healing, but there's no signs of infection or any other problem. Removing the jewelry is not going to be an issue. It's probably going to close in a few days. You're going to be left with scarring regardless, but for the most part, there's nothing to worry about. The same thing goes if the piercing is healed and there's no signs of infection or problem. Removing the jewelry, not an issue. Now, if there are problems like signs of infection or bumps or other things, always best to consult your piercer or a medical professional before removing the jewelry. And that goes for either healed or unhealed piercings. One final thing is, a lot of people freak out and they think there's something wrong because when they squeeze the now abandoned piercing, I don't know why they do that, but they do, this kind of waxy, oily, yellow stuff comes out. What that is sebums, sebum. It is a natural product. It's something your body produces all over your body. It oils or lubricates your hair follicles. It also makes you helps to make you watertight, so you don't, water doesn't leak into your body. We produce it all over the place, and in tight crevices and tight areas, we tend to, it collects inside things like piercings. And it smells awful. Think about if you didn't clean your belly button for a week or two and then you stick your finger in there, that kind of smell. Don't worry about it. It's completely natural. Nothing needs to be done. Just clean the area. Well, that's it. Do you have this piercing? Do you have a faux rook? What was the experience like? Got any hints for anybody else? Please leave a comment. If you have any questions about this piercing or any other ones, feel free to leave a comment. Till next time, here's hoping you'll piercing seal with ease and without a single issue. And if you're in the Des Moines, Iowa area, I hope to see you for your body piercing needs in the future. Have a good day, everybody. Take care, and we'll see you in that next video.